my name is Ananya Uddanti, and today I will be presenting on thalassemia and the social stigma surrounding it. So first, a little bit about me. I'm a rising senior at Little Rock Central High School, located in Arkansas, and I aspire to become a pediatrician in the future. I established a nonprofit initiative in 2020 entitled Help to Inspire. Help to Inspire has been continuously working towards addressing health inequities as well as educational inequities, both locally and internationally. I'm involved at research in a local university focused on cancer therapeutics and molecular biology. I'm also involved with the American Red Cross as a Missouri, Arkansas team lead and the founder of my school's Red Cross Club. I'm an Arkansas congressional lead for the American Cancer Society and team lead for Science Olympiad. I also have a small business called Creations by Ananya, where I sell handmade jewelry, and these funds go towards my nonprofit initiative. So let's begin. What is thalassemia? Thalassemia is a group of inheritable blood diseases. Thalassemia is endemic to various parts of the world, and it's known as Cooley's anemia. Thalassemia disproportionately affects vulnerable populations who often lack access to healthcare facilities, and because of that, they are unable to get screened, tested, and receive necessary blood transfusions. Symptoms for thalassemia range from abdominal swelling to fatigue. Some of the complications of thalassemia range from cardiovascular issues to liver disease. Further, thalassemia increases susceptibility to viral hepatitis. Due to the way that it molecularly functions, thalassemia can result in irreversible tissue damage and failure of vital organs. And this has to do with the mutations in the DNA that it causes. So thalassemia is caused by mutations in the genes that code for hemoglobin. And hemoglobin is a vital component of your red blood cells, meaning that decreased production of hemoglobin means decreased oxygen transport by your red blood cells. And decreased oxygen to vital tissues and organs creates an issue for your body in that all complex organisms require oxygen to function properly. So hemoglobin is made of an alpha and beta chain. So depending on which chain is affected and the number of mutations an individual has, thalassemia varies in severity from mild symptoms to stillbirths. Further, thalassemia is inherited in an autosomal recessive manner, meaning that there must be two carriers within a couple in order for a child to be born with thalassemia. As aforementioned, thalassemia is endemic to various parts of the world. What this means is that efforts to reduce thalassemia must be done so equitably. Areas in the Middle East and Mediterranean already have legislation in place requiring married couples to undergo screening. However, areas such as Southeast Asia and Africa do not. Therefore, efforts to combat thalassemia in these two places look different, meaning that efforts in the Mediterranean and Middle East are more focused on combating stigma, while areas in the Southeast Asia and Africa are focused on increasing screenings and testings. And like with all global health issues, efforts to reduce thalassemia must be done so in an equitable manner. So let's talk a little bit more about the stigma. So the stigma comes from the culture of these specific regions. So for example, preconception counseling should be available in these regions due to the high carrier frequency. But in the regions where it is accessible, individuals choose to avoid preconception counseling due to the stigma that comes with being a carrier. Further, for those who do undergo counseling, their options are very limited, specifically due to the religious beliefs and cultural values surrounding abortion. Further, there's a disproportionate blame placed on the mother within these couples, which adds to the social stigma surrounding thalassemia. So overall, in order to reduce thalassemia, there must be first an increased education surrounding it in order to combat the stigma. Combating the stigma will allow for individuals to be more willing to go get tested. However, we also must ensure that these tests are equally accessible to all individuals in these areas. So thalassemia, again, is widespread in terms of prevalence, with 270 million carriers and 70,000 infants a year born with thalassemia. There is a great need for healthcare policy and government-backed efforts to increase accessibility to blood transfusions and exams. So healthcare policy can look like various different things, the main two forms being testing and screening. So testing is more for individuals who are ethnically at risk but located in different countries where thalassemia is not endemic. Screening, however, is more efficient for areas where there's a high carrier frequency and it's more population-based. So on the screen here, we can see a CBC or a complete blood count test being done. And this is one of the methods, screening methods specifically, that are used in a high carrier frequency population. And Adanagram, India, located in the state of Telangana, is one of them. So this is a complete blood count machine that was donated by Help to Inspire, my nonprofit initiative, using funds from my small business creations by Ananya. The health camp here consisted of patients coming, getting their blood drawn, and their blood being examined. And based on that, and if necessary, were referred to healthcare facilities for blood transfusions. However, due to this being a tribal area, there are no paved roads to cities nearby, indicating that the location of Adanagram decreases the accessibility of blood transfusions or future medical care for these individuals. Further, the cost of transportation makes it even more inaccessible. Likewise, for ethnic minorities located in other countries where thalassemia is not endemic, the fact that their insurance might not cover these exams cost is also an issue for them. Here's a little bit more about what I aim to do in collaboration with Bannu Arga Seva Society. We are undergoing efforts to establish a Red Cross within proximity of Adanagram to allow for easier access for blood transfusions. Educating the women of this region to both combat the stigma surrounding thalassemia and also reduce the amount of early marriages being done. Everyone watching can do their part by educating themselves and educating others about thalassemia in order to combat stigma, which again allows individuals to be more willing to go get examined and screened. We must understand that genetic disorders come with a negative perception. So in order to combat that and address thalassemia in terms of a global health issue, we must combat the stigma first. These are my references. I would like to thank the Global Health Leaders Conference at Johns Hopkins University for this opportunity. The thalassemia screening camps being one of the biggest projects that my nonprofit has taken on makes the opportunity to speak about this ever more special. Further, I would like to thank Bannu Health Organization and Dr. Charanjit Reddy for collaborating with my nonprofit for this project. I would like to thank everyone who's watching this. Thank you for your time. And if you have any questions, these are my contact informations.